Christine Schneider, the Visceral Voice.
Welcome to the Visceral Voice podcast. I'm your host, Christine Schneider. Every 2 weeks on this podcast, I talk with voice specialists, manual therapists, health specialists, psychotherapists, movement practitioners, and professional voice users about voice science, function, medication, movement, puberty and aging, and everything in between. I am on a quest, not only to become a better manual therapist, but also to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, and a manual therapist. Join me every 2 weeks as we strive to provide current, knowledgeable, creative, and compassionate information to help restore, regain, and create happiness and success in your vocal journey. Hello, everyone. If you haven't already filled out the questionnaire, please do so. This really gives me ideas of what direction to take the podcast in, and I really appreciate your ideas. So thank you for filling out the questionnaire for those who have, and thank you for those who are going to. If you enjoy this podcast and you would like to become a supporter for a donation of $5 a month, you not only get my complete gratitude, but you also get to send in your questions for my guests. You can find a link for Patreon in my show notes. Thank you so much for considering becoming a supporter of the Visceral Voice podcast. I am very grateful for your consideration. I hope that you continue to enjoy the episodes. Please give me your feedback, and I look forward to hearing from you. Jacob Lieberman is a registered osteopath and psychotherapist and specializes in the management of vocal crisis. Jacob is an internationally acclaimed expert on physical and psychological management of voice disorders, swallowing difficulties, and associated symptoms like globus. He has co-authored articles on the clinical relevance of muscle and joint dysfunction. He researched and developed protocols for physical examination and treatment of muscle tension dysphonia and associated symptoms. He has contributed chapters to a number of textbooks, including Diagnosis and Treatment of Voice Disorders, Treatment of Voice Disorders, The Voice Clinic Handbook, and others. His interest in the underlying emotional issues in many voice disorders resulted in him developing some of the first clinical tools, combining psychotherapeutic concepts with specific laryngeal palpation to identify such issues. In the beginning, he was one of the only laryngeal osteopaths in the UK and Europe. In recent years, laryngeal physical therapy is becoming more commonplace, in no small part due to his courses on osteopathic medicine and laryngology taking place at the Deutsche Stimmklinik, Germany, with Professor Markus Hess and his team. His research and clinical work added insights into better understanding of laryngeal mechanics and a better understanding of associated symptoms like TMJ dysfunction and globus complaints, unexplained pains, decreased vocal stamina, conversion voice, and more. For more information about the work and future courses, you can visit his website at www.jacob-lieberman.co.uk. I am so thrilled to bring you this episode with not only one of my greatest mentors, but also a very dear friend. Here you are, my conversation with Jacob Lieberman. Jacob, welcome to the podcast.
I'm very excited about this new methodology.
I am so honored to have you here. We met 8 years ago in London when I first met you and trained with you in your clinic and observed you in the voice clinic at the Queen Mary's Hospital. And then I took a course with you in Vancouver, and I assisted in bringing you in to teach at the NYU Voice Center. And we've worked together in my private clinic, and I'm unbelievably grateful for your guidance and mentorship over the years. So I am just so thrilled and honored to have you here with me on the podcast.
Thank you. It's always a pleasure to work with you.
Thank you. So you are a registered osteopath and a psychodynamic psychotherapist. Can you tell us about your journey into becoming an osteopath and a psychotherapist?
Yes, it's all started at high school. We used to have a philosophy lessons, and we were introduced to Maimonides, who was a scholar, a Jewish scholar who was a doctor, a philosopher, and many other things at the 13th century. And I remembered one phrase that he said that healthy spirit lies in a healthy body. That really struck me before I knew anything else. And then through my adult years, when I was at university, I met Moshe Feldenkrais. Everybody knows Moshe Feldenkrais, whom I worked with a little bit in Israel. And I was so embarrassed to find out that I knew nothing about my body with all those university degrees. And I also had a very, very dear friend, a chiropractor in Switzerland, who also treated me for a neck problem. And he clicked my neck literally, and this was the click that changed my life. And I decided to retrain and to start from scratch. And osteopathy appealed to me because of the philosophy of it. When I was a student, I was a mature osteopathic student. I was intrigued by patients who did not improve. No matter what you did to him osteopathically, they did not improve. So when I graduated, I became a member of the faculty, and I started a chronic pain clinic, and I defined what a chronic pain meant. And the students used to come to me with patients who didn't get better, and we started looking into those patients. And I realized that the missing link was a better understanding of the psychology. And that brought me to do a full psychoanalytic psychotherapy course for children, adolescents, and families at the Tavistock Center in London. And I combined them together.
So important. The combination of the two together is so important.
Yes, I didn't know how until I started working with voice, which was a bit later.
How did you begin working with the demographic of professional voice users?
Okay, well, when I really wanted to do some research on osteopathic principles because they looked so clever, but there was no research into whether they were true or false. And I wanted to do some research on chronic tonsillitis because I found a technique to deal with tonsils. But no ENT wanted to talk to me because in those days it was a big thing to do tonsillectomies. So they didn't want really, they were not interested. But then ENT heard that I was looking to work with an ENT person, and they started a voice clinic in '89. It was the first voice clinic in the UK. And they said to me, "You're an osteopath. You know a lot about posture. Posture is important for voice. So let's come with us. Now, let's come and work with us." So I joined them. And I didn't like, a slogan. Posture is important for voice because really, if you really believe in a slogan, you really need to understand the links, the physiological links. In what way posture affects pathology of voice. So we got some money in '91. We got some money to run a proper double-blind research, and I treated half of the voice population with osteopathic posture correction stuff, and the opposite was a speech therapist who worked speech therapy with half of the patients, and then we swapped. And to our sadness, dealing with posture didn't improve much on the voice issue. But because I had the 90 patients on the research program, I had the opportunity to start palpating 90 patients. And I found fascinating things about laryngeal function. We didn't even know the functional anatomy of the larynx. So I started documenting all my findings, and it took me 2 years to develop the first Lieberman protocol for laryngeal examination. And then we started looking more and more into dysfunction, like if you have a mechanism like a joint who is stiff and doesn't work, if you improve its function, you improve the voice. So that's how it developed, almost by chance.
Wow. Wow, all of this. You are the father of laryngeal manipulation, and it all kind of came out of chance. That's so amazing.
It is in a way because in parallel, without my knowledge, there was a clever speech therapist in the States, Aronson, and he, as a speech therapist, they don't really teach anatomy and physiology the way osteopaths deal with it. But he had a notion that muscle tension is to do with muscles. So he started touching patients in certain places without any specific diagnosis. And he was the father, I think, of what you call in the States circumlaryngeal massage. But in the eyes of a osteopath, it's not specific. There is no diagnostic procedure. So you don't really specify what you do. But I'm sure that if you do something intuitively and you touch a tight muscle, you will help the patient, no doubt. But it's not a rational approach. And it's basically a non-specific technique in my eyes. But still, to be fair, I mean, he introduced, let's call it non-specific touch therapy for voice patients. So that was Aronson. Parallel, we developed as an osteopath, and I try to introduce a rational health system which includes diagnosis and the specific treatment into the voice world. That is my mission.
Yeah. And you've done a very successful job.
Well, it's an uphill struggle, but yes, I tell you why, because it requires a lot of skills. You know the difference between really deep knowledge, deep palpation skills, to something a bit more superficial. They have different, I think, achievements.
What would you say to therapists, or what would you say about other teachers or something saying that circumlaryngeal, laryngeal manipulation, and something like myofascial are all the same?
Yes, I think they are right, because if you do something non-specific, it doesn't matter what name you give it. In the end of the day, it's the same technique. In fact, myofascial is a named technique in osteopathy. We have about 20 or 30 techniques, and myofascial is one of them. And circumlaryngeal is just saying in simple language, rolling your finger in an area. I mean, it's nothing more, nothing less. So it's basically not much different to myofascial or any other thing that you don't rationalize. They're all the same.
They're the same, but different from laryngeal manipulation.
Very, very different. Yeah, no. When if you see, let's say, a myofascial who does soft tissue, and myself, you probably will see the same. But what stands behind it is very different, because I'm doing a specific technique in order to achieve a change which is part of a mechanical system. And the reason why I do that is because I palpated it as a diagnostic procedure beforehand, and I know exactly what I want to achieve. You see what I mean? It's not just to say I want to relax the muscle.
Yeah, absolutely. Can you talk to us about how emotions can affect the voice and how it might manifest physically in the body as a result?
Of course. Well, it's a very, very well-known model. You know, the three Fs model. In fact, it's a 4F model. If you in a state of fear, either you fight, or you flight, or you freeze. And this model is a very, very old-fashioned knowledge. And there is the old brain center, the amygdala, which is part of the survival, vegetative responses. And when you are threatened, the body goes into a state. And so this is, I think, the first link between emotion, like fear, and a translation into action. It's like the most primitive response. And it's to do with, let's say, if you are frightened, you have increased blood pressure, increase of heart rate, increase of breathing frequency, and so on and so forth. And likewise, you tighten up in your throat. And of course, in a more sophisticated world, this 4Fs model becomes a bit more complicated, because, for instance, if you are in a funeral and you feel embarrassed to cry, you will block your tears, by contracting your throat muscles. And for many people, it becomes a habit, for instance. It's like grinding the teeth. So that is the link. And of course, if you are unable to metabolize an emotional situation, like an emotional conflict, if you cannot metabolize it by analyzing it mentally, you will somatize it. because the energy, the emotional energy, has to have an outlet, and if you don't outlet it by mental processing, you will develop body processing, and that is the link.
Mm-hmm. And when a patient comes in to you, especially a professional voice user, there are a few things that you let them know that they might experience, and one of those is that they might be more emotional for the next couple days.
Yes, the reason being, because if you come, let's say, if you're a professional singer and you are very anxious, and you suddenly get this tremendous relief because somebody can help you, that's by itself is a cause for tears.
Mm-hmm.
Or maybe you just unblock, you relax the larynx, which is used to hold back emotions, and when you relax it, you literally get a sense of relief, which is a outburst of either laughter or tears. And you can also feel tearful or excited because touch therapy is very powerful on its own right.
Mm-hmm.
So that's by touching somebody, you can get a very powerful emotional response. Touch is the first human experience. So really, touch therapy has many, many layers to it.
Yeah.
In particular, when you work in almost a junction of body mind, which is the larynx.
Mm-hmm. Yeah, my clients are often really surprised and interested when I let them know that. And then when I hear back, they'll say, yes, I was very emotional, or, oh my gosh, I felt so happy. I couldn't stop laughing. So I hear a lot about this emotional response. And I know there are other practitioners that really don't think it's important, or they think that they shouldn't say that because even though it could be a response, they don't want someone to be expecting it. But working with the demographic of professional voice users, if they experience an emotional response and they don't know about it, in my opinion, it could cause more anxiety, more fear. Like, why am I experiencing all of this? Oh my gosh, maybe I shouldn't have had that session right before a show. But if I let them know that they're going to experience it, it helps them so much. Go, oh yes, Christine told me this would happen. Okay, I'm totally fine.
Yeah, I couldn't agree with you more. And in fact, I like to prepare people for all sorts of reactions, like they might experience a little bit of ache after the session. If people are told, what to expect, there is no problem. The anxiety sets in if suddenly they feel something and they were not warned about it. It's a big, big difference. So I will always advise people about potential four possible reactions, which might be a bit of pain after the session. They might feel a bit of mucus running down the throat. They might feel emotional and very, very tired. So these are common response to touch therapy.
Yes, and thank you to your mentorship. There is not a first session I have without telling people those 3 possible symptoms that they might have. So,
Yeah.
And it's been very beneficial. I'm really glad I say it because a lot of people experience it.
Yeah, you're right.
So what is the difference between a held and guarded larynx and a backed larynx?
Well, I observed 3 different things. A held larynx, it means that ad hoc, either maybe because the patient is a bit anxious, they put a bit of tension or they contract the laryngeal mechanism. Maybe ad hoc because they are a bit anxious from the examination, for instance, or the encounter with a stranger.
Mm-hmm.
But when they relax, they let go and the larynx drops. So this is transient, what I would call transient held larynx. That in a certain circumstances, they tighten it up. And then when those circumstances disappear, the larynx can relax. And there is a definite move. The whole larynx drops down and the tension between the hyoid and the thyroid also decrease. So there are 2 dynamic changes on a held larynx when it's relaxing.
Mm-hmm.
Now, the tight larynx is what I would call a bricklayer larynx. Let's say a very normative, balanced teacher who had never had any voice training, and she's teaching or he's teaching for 30 years in a very noisy class. the larynx will get tired. It will get stiffer and tighter, and until it develops symptoms. In those circumstances, you would not see the same drop of the whole larynx down, let's say on a yawn, and you will not feel any difference in the distance between the hyoid and the thyroid. So this I call a bricklayering larynx. Now the back larynx is a completely different thing in a way, because it's like a habit whereby the larynx is pulled against the spine. And I have a specific criteria to say if it's a back larynx or not. If I am unable to palpate the posterior margin of the laryngeal lamina, I will call it a back larynx. Sometimes it will be tight on one side and not the other. So these are the three observations.
Yeah. So we had the held larynx, the tight or brick layered larynx, and the backed larynx.
Yes.
Yeah. Can you talk to us a little bit about the cricoid visor and physiological and functional changes that might occur if it's locked, closed?
Okay. First of all, the cricothyroid joint is the tensor mechanism. This is the mechanism that will change the length of the vocal folds. So when we stretch the vocal folds and you palpate the distance between the cricoid and thyroid, this distance will be minimal. When we go into a low pitch, the vocal folds get shorter and thicker, and you will see that if the cricothyroid joint works properly, the gap between the cricoid and the thyroid anteriorly will get bigger. So this is the idea of the function of the joint. So this is like the primary tensor mechanism. Now, if it's, for instance, if you talk, let's say if you have 3 octaves as a singer, and your speaking voice is, let's say, sitting on the higher octave, in the long run, what happens, the cricothyroid joint is held on the closed side because the vocal folds are chronically longer. And then, of course, you will begin to lose the ability to shorten the vocal folds. That means that you will have some difficulties to go into your chest voice after many years of not going there. So this is the idea of a locked cricothyroid joint in the high pitch configuration. And that's very easy to diagnose, and it's a bit a tricky technique, but you can relax it and encourage the vocal folds to shorten. Because in the end of the day, you want to achieve a physiological speaking voice, almost effortless. That will always be in your lower octave, not in the highest one.
And so if we see someone who's younger that might be experiencing a bowing of the vocal cords?
That's, I think, if the neurology of the mechanism is intact, I think that is a long-term vocal abuse on a high pitch. In one of my lectures, I show a person who is using a secondary mechanism to raise pitch without using the cricothyroid joint. You can see there is no difference in the length of the vocal folds, but they can still elongate the vocal folds. And this is because the way muscles work, it's isometric and isotonic type of contraction. And they are using secondary mechanism like isometric contraction, which means that there is no change in length, but there is change in tonus. But that, of course, is high contraction or high pressure, if you want, because they are not using the primary tensor mechanism. And with manipulation, you can restore the action of the cricothyroid joint.
Yeah, great. So if a patient walks in to your clinic and they are describing a click when they are swallowing, what are possible causes of this, quote, clicking?
Well, one source of this clicking is a lack of distance between the hyoid and the thyroid. Because the thyrohyoid mechanism is a second mechanism to elevate the larynx. So if you palpate a distance between the hyoid and the thyroid, there should be some gap there. And on swallow, this gap will diminish. But with a patient who has chronic contraction of the thyroid muscle, and the hyoid and the thyroid have no gap between them, when you swallow, there is a relative movement between the hyoid and thyroid. And this relative movement creates a click. So that's one source of clicking. There are other type of clicking, like a ligament click. I had few patients who had car accident, and the safety belt pulled something on their larynx, and they developed this click. And it's all around this area of the thyroid. And there are other type of clicks, which is called crepitus, which is not the same, and that's where the thyroid sits against the spine, and when you move it from side to side, you are going against a surface which is not smooth. So this is another reason for noises, but that's not the same as laryngeal click.
Right. Great.
By the way, it's not documented, and doctors know about this click.
Yes, some of the clients that I've seen who have the click when swallowing, after having seen their laryngologist, the laryngologist has said, well, I can remove part of the hyoid bone, but I can't guarantee that that's not going to cause other issues. So if you can stand to live with it, then you should do that.
It's horrific, really, yeah.
So what are the most common findings in your assessment of professional voice users?
Okay, on the physical side, all the findings will stem from a muscle tension, like chronic contraction. In generally speaking, mechanical symptoms will end up in pain, in ache, in stiffness, in decreased range of movement, loss of stamina. Recovery time between show will get longer. That might mean that, let's say, you cannot do the matinee, but you can do the evening show. Quality of the voice, hoarseness, because you cannot achieve good closure. We are assuming that the vocal folds are intact, okay? So all those symptoms can come from a lack of muscle power or muscle flexibility or joint flexibility to do what you need to do. For instance, singers might suddenly complain that they cannot negotiate the passaggio. It wasn't a problem, and suddenly it becomes a problem. And I think because the larynx becomes stiff, and the manipulation that you have to smooth out the transition, the passaggio is not there anymore because it's too rigid. So these are the type of symptoms, lack of range. They lose the top notes or the bottom notes, feeling of tightness, feeling of a ball in your throat, things like that.
Yep, great. What are 3 things that you wish your patients knew and understood about the voice?
Okay, the first one is to know that the voice or the voice production is a muscle activity, and in order to achieve an efficient voice, they need to use the minimum effort. Remember, the larynx is a dynamic mechanical instrument. So the less tension, the lower the voice, which means that if you talk in your chest voice as a habit, that's the first thing I would advise them. The second one is to explain that voice production, it's a wind instrument. And in a wind instrument, you really have to blow, to exhale, which means that you have to blow into it. Now, the problem is that for breathing, we have to keep the vocal fold apart. For speaking, we bring the vocal folds together. That means that biologically, it's not possible to breathe and speak at the same time. Biologically, it's a conflict. It's a paradox. The fact of the matter is that we do speak, but we are using the instinct to close the vocal folds for protection, really. And once they are closed, we begin to push air. But that, of course, means that the default of the system is muscle tension. Now, I try to teach people to override the instinct to close the vocal folds, to start exhaling, blowing out, and only then to bring the vocal folds together very slowly. So I think because of biological paradox, we are encountering all those issues of muscle fatigue. And the last thing that I want them to know is to avoid talking in a noisy environment, because there is this Lombard effect that when we are exposed to noise, we end up shouting. So if people knew to speak at the most comfortable lower voice, to know how to synchronize airflow with voice production and to avoid noisy places, they will never develop voice problems.
Yes, there is an app now that you can bring with you into noisy restaurants and places, and it rates how loud it is and whether or not it would be safe for you to speak.
Nice.
No, isn't that amazing? Some of my colleagues
Good.
have it. It's incredible. So you, for years, have worked in Hamburg with Marcus and doing research and collaboration. What are some of the things that you have learned through your collaboration with Marcus?
Oh, endless things. First of all, I learned that there are endless vocal fold lesions. People normally talk about nodules and polyps and a bleed, but in fact, they are so variable and complicated. So that's what I learned at the vocal fold level. The second thing, because Marcus was very generous with his time, and we went down to the lab and we had many hours of studying cadaver larynxes and the mechanical effects of manipulation on the larynx. And then from cadaver studies, we started looking into the effects of laryngeal manipulation on patients with camera in, and we learned a lot about diagnosis, mechanical diagnosis, and also the specific maneuver that will get to every part of the vocal tract and the vocal folds. So it enables me even to deal with the arytenoids on a stiff arytenoid or maybe paralyzed arytenoid. It's amazing. So really, since I started working with Marcus, my work really increased exponentially. Also, we realized the importance of the psychology as part of integrated part of a voice clinic. You really need to have a lot of understanding of that, both for surgery and also for non-surgical pathologies or complaints. Let's say globus is a typical psychosomatic disorder, and it's not to do with acid reflux. It's, as I said, it's a psychosomatic one. And these are the type of complaints that will walk into the voice clinics. So our working together was really something so fruitful, and it enriched both of us, really.
I'm going to come. I want to come and join your team.
Sure.
Okay, so I am going to move on to my signature questions. What is some advice that you would like to give to an aspiring young performer?
Well, I like to talk about 5 things, because voice production requires 5 elements. Let's go from breathing, which is the power source, the frequency, which is the vocal fold function. The third element is the vocal tract, which is the resonating chamber, and the state of mind. And the last one is posture. So with regard to breathing, I would advise a young performer to really increase their capacity to exhale. It's not about where you breathe from, but it's about your capacity to blow air out as long as you can. Normally, if you ask somebody to blow out, they will do maybe 7 seconds, and I will try to encourage them, maybe help them with manual therapy, to increase it to 15 or 20 seconds of the ability to blow air from zero, not to inhale first, if you see what I mean. But you exhale to your normal lung capacity, and then to carry on blowing out from zero, 15 to 20 seconds. So that's the first advice on the power source. And on the vocal folds, I will try to encourage them to go into proper chest voice and to stay there for the speaking voice, because we run more mileage speaking than singing. With regard to the vocal tract, I will encourage them to keep it in a relaxed, open state by stretching, by yawning, by all sorts of tricks. So the instrument is ready to have the full range from chest voice to the highest pitch and down. And with regard to state of mind, I will give them some advice on anxiety. We'll try to understand a little bit more about what makes them anxious, maybe to give them some ways to handle anxiety before going on stage. That's state of mind. And posture, I will advise them about head position maybe. So these are the 5 things I would like to help young performers with.
What is your favorite quote?
Well, I already mentioned that a healthy soul in a healthy body, and the body never lies.
Mm-hmm. I love those. What are your favorite song lyrics?
That's from the Eurythmics. It's old-fashioned.
Uh-huh.
Here comes the rain again.
Oh. Who influenced you as an osteopath and psychotherapist the most?
Well, as I already mentioned, my Feldenkrais and my friend the chiropractor, and a few tutors at the British School of Osteopathy. They influenced my thinking, and as a psychotherapist, through my working with my analyst and my sister, who is a very, very good psychotherapist.
Oh, I didn't know that. What is something new about the voice that you learned this week?
Well, again and again, the impact of a state of mind on the voice production. That's really strikes me time and time and time again. And every time I can see a different reason for voices to fall apart. And they are always emotional in the background.
Mm-hmm. What is one item you could never live without?
My motorbike.
What is one thing you have on your bucket list?
Well, I love sailing, so sailing on a sailboat, of course, not a motorboat, to exotic places and maybe rough seas. That's a really old dream of mine. And I'm really eager to do fMRI studies on brain function with regard to before and after manual therapy, because this is something that has never been done. And because of the results are so fascinating and dramatic after laryngeal manipulation, that I really believe that there is some central impact on the brain. And I'm really hoping to pull up together research using fMRI to study those effects.
I can't wait to see those. What is the most delightful word you can think of?
Happiness and health.
And what is your favorite book?
Well, my favorite book really is Catch-22 because it's cynical and it's present, the futility of wars and also how things are dealt with. Yes, so Catch-22, old-fashioned book.
What are you currently learning?
Well, how to improve my teaching skills, how to make, complicated stuff more accessible to people, and just reading a lot about the placebo effect, and so this is and to improve my knowledge in anatomy.
Always,
Yes.
right?
This is my hobby.
Yes, it's a lifelong journey of learning more and more, deeper and more into the anatomy. What do you wish you would have learned sooner?
Well, the same as I do today, but 10 years earlier, I did something completely different, and I really changed direction. When I was 32, I wish I had another 10 years of what I'm doing today.
Jacob, if the listeners want to get in touch with you, if they want to connect with you, what would be the best way to do that?
My website, I'm trying to update it. To my shame, it's not interactive yet, but it's jacob-lieberman.co.uk. And I have my contact number there and the email and a bit of information.
Amazing. Thank you so much for taking the time to do this interview with me today. It is always so amazing for me to hear your voice as you are my mentor across the sea. So I am so grateful for you to be here with me on the podcast episode today.
And I'm happy to have you as a friend as well as a student. I really enjoyed talking to you.
Thank you. You too.
Thank you all for listening. If you enjoyed this podcast, please share it with those you know. You can also subscribe, rate, and write a review. If you want to connect with me, you can now find me on Instagram under The Visceral Voice. You can find me on Facebook under my name or under Lifelight Massage, or you can check out my website at lifelightmassage.com. Please join me in 2 weeks for another wonderful conversation on The Visceral Voice.